Hi, Ying. Thank you so much for spending some time with me today. So we're here on behalf of the Chuckanut Health Foundation. You're a board member on the Chuckanut Health Foundation board,
Hmm.
and we're working together on this big drawing for a truck to try and get more people in our community to get vaccinated. So Ying, can you tell me why this project and what you're excited about for it?
Well, I'm excited because I think we're close to the end of a really long marathon. This feels maybe like mile 22 out of 26, and the end is in sight, but there's still lots of ways things could go wrong. And people are tired, and I think we need to keep pushing hard to get to the end of this. And to me, the end of this means where there's so little transmission of COVID-19 in the community that it really doesn't impact people's life on a day-to-day basis. And the only way really for us to get there is to have really high immunization rates. I know the number 70% gets tossed around a lot, but that's just an arbitrary number. And really the higher the better. I expect that there's a percentage of people who are not comfortable with the vaccine, and I can understand that because it is still under an emergency use authorization, and it is a relatively new vaccine, although not as new as many people think. But I think 90% is a reasonable goal, and at 90%, there's likely to be so little transmission that we really don't have to worry that much, and people can go about their lives without too much restriction, which is, I think, especially going to be helpful to us because we're right up against the Canadian border. And when the Canadian border opens, there will be a movement of people, and it's important for our economy that the border be open again. And as part of preparation for that, a really high immunization rate will help us, especially the folks in the North County.
So Ying, you've been on the front lines as a family care physician of this pandemic. You have been seeing patients the entire time. Can you tell us a little bit about your experience and what that's been like this year, these last 18 months?
Well, it's been different, but in many ways, I feel very lucky because people have been so kind to the medical community about this, but really, I don't know that it's impacted us as much as so many other parts of the community. I never had to worry that I was going to be out of a job. I always had work to do. I still got to go to work in person. I still got to see people. I still got to see my colleagues. Yes, we were wearing masks and washing our hands a whole bunch, but my life didn't change nearly as much as it did for so many other people. My whole work didn't get turned upside down the way it did for the teachers. I wasn't, seeing thousands of people a day like someone who works in retail or in grocery, who had really, in many ways, much more exposure than I did with less protection. But in terms of what I saw of the disease, it's exactly what's reported. It's really variable. I had patients who had COVID-19 who didn't even know it and felt completely fine, and all the way to the other end of the spectrum, where I lost some people and had people die. And to me, one of the worst things about this pandemic is that many people died alone in ways that no one would wish for. And that's just so unfair. And hard on the family and hard on the staff who took care of them and had to stand in for family who couldn't be there. It was tough. And I took care of a guy who his comments about how sick he felt really can't be repeated in a family-friendly scenario, but he was amazed at just how terrible he felt. And this was a completely healthy guy a few days before, and he just felt awful. He did all right, but it was a pretty big deal there.
Wow.
So it's all across the board. I mean, when people say I got it and I felt fine, it was no big deal, I'm sure that's true. That was true for a lot of people. But it wasn't, but there were a lot of people who were very sick.
Yeah. So tell me what the vaccination has represented to some of your patients. What does that mean for them to get vaccinated?
I would say the main thing has been a sense of relief and freedom from fear. People have been able to, it takes a while after you're vaccinated to really get the feeling that it's as safe as it is. But people, it's kind of like I don't know, it's kind of like a hermit crab coming out of its shell. People are very slowly creeping out, and they're liking it. They're liking being able to be back to a life that is more social and seeing people again. Um, I just had my first in-person guitar lesson in 18 months, and that was really nice. It was way better than doing it on Zoom. Um, it's so but for many people, was just this tremendous dark cloud of fear. I've had patients who hardly left their homes for months and months, and now they're feeling like they're able to get out, not just because they've been vaccinated, but because they know that a substantial percentage of the community has been vaccinated, which means there's just less risk of transmission.
Mhm. When you look at our vaccination rates in Whatcom County, it varies by region. Different geographies have different rates, and they have different infection rates as well. And you said that, we talk about 70%, but really it would be great if we got 90%.
Mm-hmm.
So I'm curious about this idea about the truck incentive. How do you think this might help us reach our goal of 90%?
Well, I think there are a lot of people who are legitimately on the fence about getting vaccinated. Maybe, it's a complicated subject. Some people, I think, haven't had the time to really dig into the information that they need to make a decision they're comfortable with. People may not have had time to talk to their doctor. A lot of people weren't coming to the doctor very much. I've had many patients in the last couple of weeks who it's the first time I've seen them since the pandemic started. And one of the questions they asked me is, well, what do you think? Should I get vaccinated? Because they just wanted to ask me before they decided. There's a lot of folks where the pandemic has made them so busy. A lot of parents trying to distance school with their kids, rejuggling their jobs, all the teachers who've had to completely reinvent their entire profession at the drop of a hat. I know lots of families where it's like they just are so busy they can hardly do one more thing. And so, and it is a big decision. So I think there's a lot of folks where a little extra incentive, a little extra enticement may be enough to help them get over the hump. I also have, a decent percentage of people who are just terrified of getting any shot, and it's just not easy. And so that means they may need to organize and bring a friend with them. And fortunately, recently, we've had good supply of vaccine in the community, and I think that will continue. But, it's not, I think we shouldn't be judgmental about other people who haven't gotten their vaccines yet. A lot of folks, there are real legitimate reasons why they haven't been able to do it yet. And, I think we should be really grateful to the people who have been vaccinated and took the time and took the effort in those early days when it was so hard to find. I've had patients who spent days on the internet looking for a shot and then drove 100 miles to get their shots. I have a bunch of patients who went to Whidbey to get their shots for some reason, but so I'm very grateful to all those folks, because without them, we would be in much worse shape. But the job that remains to be done, and I think is urgent to get done, is to vaccinate the folks who are not yet vaccinated. That's got to be the priority, because that's how we get the rest of the way to the end of this marathon. And so that's the reason for the incentive to be focused on that population. It's not really about rewarding people for having done the right thing. It's to help give a little bit of a boost to help people get off the fence and just get this done.
Mm-hmm. So some people have said that they don't feel like it's fair that there's a start date of June 1st for this drawing. And we've talked a lot about that, and we're sticking with that. Can you talk to us about why we would do that?
Well, I think, I agree. I mean, I hear that. It's not fair, If we had this to do over again, would we make better incentives from the beginning? I think that wouldn't have made sense, but that's water under the bridge and we can't go back in time. I guess I would also say there's nothing about this pandemic that has been fair. It's been the impact of the disease, the death, the disability, the economic impact. None of it has been fair. It's all been actually terrifically unfair. And I think the fairest thing we can do is get to the end of this as fast as possible. And that means vaccinating as many people as we can, as fast as we can. And I feel quite urgent about this because I get the sense from all the public discourse now that there's a headlong rush to opening society completely. You know, California has lifted all of their mandates for masking and distancing and capacity. I think the same thing is probably coming soon in Washington. And really, if we're going to do that, and I think at this point there's no way we're going back, our only protection is going to be our vaccination rate. And so that means in this next few weeks, we have to get those first shots into as many people as we possibly can, as fast as we can. And that's the reason for this focus on this time frame.
Mm-hmm. Have you thought about like what happens? What are the scenarios that happens if we don't reach a high enough vaccination rate?
Well, this is a little grim to think about, but I mean, we've seen this happen over and over again. Every time we've done well in the community and our disease rate goes down and we let our guard down, then a few weeks later we have another spike. And the size of the spike depends on our behavior and how many people are vulnerable. So since we are, you know, the different communities are immunized at different rates, but if you're a community that is, say, 50% immunized, then your spike is going to be 50% smaller. And if you're a community that is 30% immunized, then your spike will be 30% smaller. But the 70% of people who are sick will be just as sick as they would have been 6 months ago or a year ago. Treatments are a little better, and you know, the antibody treatments are now more available on our community, so that's a help. But the risk is still very real. And that's without figuring in the effect of these new variants that are possibly a little more dangerous. So I think the equitable thing, the fair thing, is really to boost the immunization rates to 90% in all the communities in Whatcom County as fast as we can. And that will make the disease burden more fair. You know, my wife has been doing volunteer contact tracing since she retired. And her recent comment to me has been, the folks who are getting this disease now, with rare exception, are folks who have not been immunized and they don't know where they're getting it. So it's just cruising, the disease is cruising around in the community in a way that's very hard to identify. And so it's not so much, you know, these are people who are being careful and they're getting it anyway. So I think we just have to be aware that it's still out there, it's not gone, and immunization really protects us. The other thing that I've heard from my colleagues in the hospital is that the folks who are winding up in the hospital with COVID are still quite severely ill, and and they've not been vaccinated. So the vaccination seems to be, as predicted, incredibly effective at preventing severe illness. And I guess that's the other thing I should say. You know, there's all this information about the vaccine that's running around out there. It's easy to lose the forest for the trees. You know, there's a concern about the Janssen & Janssen causing those blood clots in especially younger women, and that's being watched closely. And there's a concern now about 300 cases out of several 100 million doses of heart inflammation that have turned out to be pretty mild, and most people have done fine with it, but that's being watched closely. But those are small trees in a very large forest. The large forest message, the big overview, is that these vaccines are remarkably safe. They are stunningly effective, and they just work so well, and they are so safe. That's the big message, I think, really to focus on. Mm-hmm. And, you know, these are way better than flu shots. They're so much more effective. I mean, not that flu shots aren't good, but these vaccines are amazing. I feel so lucky to have these working for us. I was talking with one of my colleagues just a few hours ago, and he said, you know, because we were physicians, we got vaccinated in January. It was an incredible privilege, you know, to get the vaccine so early and be protected for all these months. And yeah. I just think everyone should have that privilege.
Right, huge privilege. What is the latest, Ying, on the anticipated boosters and how long it's effective?
Well, there's an answer I don't know.
Okay.
I think, you know, it's been an interesting thing to watch because of the speed of the news cycle now. The entire world has had the opportunity to watch this unfold almost in real time. The research is out there as fast as everybody knows it as fast as it's published. And so it's been interesting to see. And I think I just don't know yet. We are watching, and the immunity data is accumulating, and we just don't know when or if boosters will be needed. I have my own personal suspicions that it will probably be somewhat variable. Some people will probably get long-lasting immunity, some people won't. It'll be a little tricky to figure out, and there'll be a whole lot of numbers crunched, and we'll come up with, certainly not me, but people way smarter than I am will come up with a recommendation that averages things out probably.
We could talk a long time about the science and the research that's out there, and I think we probably should do that on one of these Fridays. And my last question for today is for those who are out there listening, who are still not sure, who have some hesitation, any words of wisdom from Dr. Wu?
I think, I think it's completely legitimate to have doubts and concerns, right? I mean, it's a new thing, and so I think you should listen to your concerns, and then talk to someone you trust. Ideally, someone who has a good base in medical knowledge. Ideally, you have a primary care physician you trust, and you can talk to them and ask them their advice and how it applies to you. Each time I talk to one of my patients about whether or not they should be vaccinated, I'm running this little calculation in my head about, is there something unusual about this person that makes this decision different for them? Just as I would with any medication. Do they need a dose adjustment because they have kidney failure if I'm giving them another drug? So, your physician can think about all those things with you, not for you, but with you, and the two of you can make a decision together. So that would be my advice. Don't just grit your teeth and do it. If you have doubts, get good answers, and that's going to be from your primary care physician.
What about for people?
I am biased because I am a primary care physician.
Sure. What about people who might not have a primary care physician?
Well, everybody should have a primary care physician. But I would say for people who don't have a primary care physician, what's my favorite resource? Actually, the CDC website, since Dr. Walensky became the director, is actually much more user-friendly than it used to be. So I like that one a lot. And that's basically straight from the horse's mouth. The CDC has taken a lot of flack, but it is still an amazing institution and really one of the guiding lights in the world on this subject. And Dr. Walensky is amazing. Yeah, she was a great pick. So, and I don't know, we could field questions, you and I. People could ask questions here, and we could field them the best we can. I'd be happy to do that.
Okay, great. Well, thank you so much for spending some time with me on this Friday afternoon.
Always. Yeah. Always happy to do that.
Thank you. And on behalf of the Chuckanut Health Foundation, thanks to everybody who's watching and listening. And we hope you'll help us spread the word about how important it is for us to get those vaccination rates up. So have a great weekend, everybody, and we'll see you next Friday.
All right. Thanks, Heather. Have a good weekend.
You too.